Hi, I'm Dr. Nick. I'm the incrementalist. I'm here at the World Healthcare Congress. Real delight to be with the Honorable Dr. David Shulkin. He is a prior administrator for the Veterans Administration, and I would say an innovator. When I look back at some of the things, you were an early creator of Doctors Quality, which was one of the first consumer kind of level reports that focused on healthcare quality. Tell us a little bit about your journey to that point.
Well, first of all, I'm a doctor, and that's the way I think about helping patients and helping patients make the right decisions. I'm a primary care doctor, and I've always believed that people need information to make good decisions about almost anything in their life, and so healthcare should be no different.
Right.
And so early on in my career, I was a big believer that we needed to know more about the quality of care that we have, the cost of the care that we have, and informing and educating patients was just something that I believed in, and glad to see that slowly but surely we're getting there. We still have a long way to go, though.
Right, and that's interesting because I can talk to a number of physicians who would take a counter position and keeping patients out. You're clearly in the patient engagement camp and the opportunity that builds and the value that they bring to the care, right?
Well, I certainly hope there aren't a lot of physicians who believe in keeping the patient out. I think that's an older way of thinking, and I think most doctors understand that in order to get the type of outcomes, the best outcomes of care, that it needs to be a partnership, and including people in their decisions is not only a right, but also the best way to help people.
I think, as Leonard Kish said, patient engagement, blockbuster drug of the century, so the real value proposition. Tell us a little bit, you presented here. What were you talking about?
I was talking about my experience in the federal government. I worked for both President Obama and President Trump, and being a member of the cabinet was a real honor to be able to help lead the largest healthcare system in the country, and what lessons I learned from that experience that I think the private sector can learn from.
So, that's interesting. One of the things that, we're hearing a lot about is Medicare for all. And, is there some model that you see where we could take the veterans system and offer that as a broader kind of capability? Can we learn from that?
Well, I don't think what we're looking to do, and I don't think that we want to propose that we take the veteran system and expand it for all Americans. I think the veteran system is designed because our veterans deserve a certain level of care and we have a responsibility to that, so it should stay designed for them. But I do think there's a lot that we can learn from the lessons of the VA that we can take outside to help all Americans. And I think the concept there is, Medicare for all is a concept that would help improve access, but it would still retain the current fee-for-service system and many of the problems of fragmentation that we see. So I think what we want to do is better than that. I think that the approach that I believe in is taking a population of patients and being able to actually provide population health approaches towards that so that you can tackle issues, you can use data in a way that helps you improve care, and you can assign accountability for the improvement of the health outcomes of the population. So I hope that we're moving towards that direction. And of course, CMS just announced a new initiative where they're exploring that, and I applaud them for that. I think that's the right direction.
So if you could think of, long career, you've looked at this, you've worked in a system that essentially delivers good care, covers this large population. If there was one thing, small thing that you could change in our current system for the rest of the population, is there anything that springs to mind that would really, help push us over the edge and get us towards this goal of a better, improved healthcare system that's delivering value for money and great care?
Yeah, well, anytime somebody says, "Is there one thing in healthcare?" I try to avoid that because, of course, there is no one thing. But first of all, I think the focus on access has to be the primary focus. Until we get all Americans the type of access to care that they need, we're going to be a lacking system. I think that in my career, transparency of information has been absolutely critical, and we need to do much more in terms of that, and that's something that I think can be done quickly and done without too much cost. And then we need to make sure that we get our payment systems aligned. Wherever you have a clinical system and clinical approaches that are not aligned with the financial system or the business model, you're never going to get the outcomes that are optimal. So I think those are the areas I'd focus on.
So in fairness, I put him on the spot. I asked him for those one or two. And in fact, he came up with 3 great incremental steps, I think. to really sort of set us on a path. Great pleasure, real privilege to talk to you. Thank you for making the time.
Glad to do it.
I'm
Thank
Dr.
you,
Nick. I'm the incrementalist. Don't let perfection stand in the way of progress.